Hello, I'm going to talk to you about test anxiety today. I can think of 4 components of test anxiety that are most common for the students that I see working in the counseling center on campus. First of all is cognitive. That is all the thoughts that run through your mind before, during, and after any dreaded event. For example, a test that you have to take. Another example is, I have to be perfect and know everything or else I'm a failure. I don't even know who I'm trying to fool. Another component of anxiety is emotional. That's all the feelings that you experience related to the anxious event, such as feeling embarrassed, disappointed, happy, relieved, or even angry. Also, there's a strong physiological component to anxiety. That includes increased sweating, dry mouth, increased heart rate, shallow breathing, or even feeling like you're having a heart attack. Behaviorally, we know that people behave very differently when they're anxious. Their body moves differently. You do things differently when you're stressed, such as walking quickly, talking louder, fidgeting, drumming your fingers on the desk. What I want to talk about is typical examples of how we respond to anxiety. Oftentimes, students will avoid studying if possible, if it makes them anxious about thinking of taking a test. Or you might want to study the most difficult courses last just because you're dreading them so much. Another example is using self-defeating self-talk. That means criticizing yourself or thinking of all the ways that you're not going to be able to do what it is you want to do. Oftentimes, anxiety results in freezing up during tests. So you might feel like you were well prepared for the test, but suddenly you can't remember a single thing about that particular subject. I want to talk to you about a different approach to dealing with anxiety. We'll talk about some ways that you can deal with your anxiety that might be more helpful. Commit yourself to trying at least one suggestion up until the next test that you take and see what kind of results you get. If you don't get the result you want, don't give up. Be persistent. Modify a little bit what you're trying. You might also want to look at additional help from counseling and psychological services. An anxiety response is basically starting as a physiological response in your body. You have a parasympathetic and a sympathetic nervous system. The sympathetic nervous system is the accelerator and the parasympathetic is the brakes. You can think of sympathetic as really getting you excited and the parasympathetic as the relaxation response. We know that you're going to need to be a little bit anxious to study or to do whatever it is you're dreading doing. So we know that optimally you want to be a little bit anxious, but you don't want to be too anxious. For things that you know very, very well, you can be a little bit more anxious and still perform at a high quality. You can think about athletes here at the university that are doing this. They're in highly anxious situations where they're in front of lots of people and they're performing very, very well. This is easy to do when you know something very well. It's much harder to perform at a high level of anxiety when you don't know something very well. One of the reasons that this is true is that your limbic system in your brain is highly active when you have an anxious response, and it's not really designed to communicate very well with your higher functioning thinking or the cortical areas of your brain. And so even though you have the information in your brain, you're blocked from retrieving it. It's difficult sometimes to see anxiety as a problem because there are many times when stress or arousal really improves your performance. You can think about times when you were able to study all night long and do very well on a test. However, stress hormones make it difficult to think clearly or recall information. Remember, I told you when your limbic system is highly activated, it's not sending messages up to the cortical areas of your brain where your memories are stored. That makes it difficult to think clearly, to make decisions, and to recall the information. Over the course of days to weeks of sustained stress, we know that the neural pathways in your brain are beginning to atrophy and retract, specifically in the hippocampus, which is responsible for memory. Also, we know that stress blocks the formation of new neurons in the hippocampus. You have different neural pathways that are created when you're learning information, and these pathways get more and more well-worn, just like the pathway in a forest. The more people walk, the more worn the pathway is, and the more clear the pathway is. This is the way that neurons work in your brain. You have different pathways, and they're formed when you're learning new information. However, high levels of anxiety will block the formation of those new neurons. So I want you to recognize anxiety reactions in yourself and the thoughts that increase those anxiety reactions while they're occurring for you. I want you to challenge those automatic reactions, and as you begin to see false assumptions that underlie your anxiety, you can begin substituting new coping strategies or new ways of thinking. Some thoughts that increase anxiety include, I'm going to forget everything, I won't remember anything, or I studied all the wrong stuff. I need to get a good grade. I wonder what's on the test. Is it going to be difficult? I didn't study enough. I didn't get enough sleep. How am my grade going to be affected by this test? I don't know. If I want to be the last one there, I hope it's not hard. How much did I really study? I'm going to fail this test. Then I'm going to fail the class, and then I'm never going to get into the major that I want. I really don't know this material. I didn't prepare enough. All of these are examples of statements that increase your anxiety. We think of negative self-talk as a set of unrealistic, hypercritical statements that you make about yourself that increase your anxiety. I'm going to give you some examples. A negative statement is, I'm stupid, I can't learn this stuff. Much more realistic is, I'm not stupid and I can learn. If I start studying now and work hard, I can learn most of it and maybe all of it. Come on, dummy, how'd you miss that? You can't do anything right. It looks like I'm in too much of a hurry. I guess I need to slow down and watch what I'm doing. This is much more realistic in terms of thinking about it. It's getting feedback about your performance and using that feedback to inform the way that you're going to continue taking this test. I hate this class. Nobody should have to learn this stuff to get a degree. Well, I never liked this class, but this course is required for my major, so it must be important, and I'm going to pretend to like it, do the work, and then see how I do. This is really important because we know from the field of psychology that sometimes action or behavior can precede emotion. So if you're behaving as if something is true, sometimes that can influence the emotion that you have. If you're looking at these realistic alternatives, you know that you're not fooling yourself by saying overly positive stuff like, oh my gosh, I'm going to be the greatest ever in this math class. What you're saying is, I can do it. I can take piece by piece this assignment or this block of chapters, and I'm going to work as hard as I can to get the best grade I can. Every point that you earn on a test is going to be 1 point more that's going to accumulate for you in the total grade that you have for the class. So you can always be looking at any action that you take is helping your overall performance. Here's some more examples of critical statements. I'm not smart enough, or I'm so slow at this. More accepting statements are, I'm okay no matter what, or I did that well. Even if you're slow, you do it well. You're getting the job done. When I was in college, I studied much longer and much harder than most of the people that were taking classes with me. And I soon realized that no matter how easy it was for other people, I could still learn the material as long as I was very persistent and put in enough time. So don't think that that means anything about your intelligence. It just means that's the way that you learn best. Look at some worrisome statements. I've got to do well to get a good grade. Or if I don't do well, I can't face my parents. More realistic statements would be, I can't be perfect, but I can do my best. And it's okay to make mistakes. Oftentimes, the things that we learn, the most valuable lessons that we learn in our life, come from the mistakes that we make. Some off-task statements. These are statements that take attention away from the task at hand. Everyone's leaving. I'll be glad when it's over. Only 5 minutes left. All of these statements take away from your focus of retrieving the information that you need for the test. If you look at on-task statements, these are statements that help you accomplish the task at hand. Just do these one at a time. I'll skip this one and come back later. This is particularly helpful if you're perseverating or focusing overly much on one you can't remember, and you start to get frustrated because you know that you know the material. You can ask yourself, what exactly do I need to know with this particular question? Some of the ways that you can change the way that you think, if you go back to some of the first things I talked about, one of the things I said was that some of the thoughts that you have increase your anxiety. Some of the thoughts that you have can also decrease your anxiety. So for example, you could think, what's the worst that could possibly happen? Then ask yourself, well, how likely is that to happen? And you can examine the possibilities versus probabilities. This is a very common mistake that people that get anxious make, and that is that they think because something is possible, it's likely. It's possible that one of us will trip and fall in front of you today, but it's not very likely. The probability is quite low that any one of us is going to trip in front of you today. It might be a little more possible now that we're talking, but in general, it's less possible. It's certainly possible, but not very probable. Even if it does happen, then what? So one of us does trip in front of you today. It doesn't really make that much difference. We'll get back up, we'll keep talking, and you'll get what you need out of the day. You can also explore the costs and benefits of worrying. Sometimes the benefit of worrying is that it causes you to study more, and that could be what you would consider a benefit of worrying. But if it starts to interfere with your enjoyment of other things in life, or if it starts to interfere with your even wanting to start studying, then the cost is too high of worrying. And again, you might want to think about talking to somebody in counseling and psychological services about helping you manage your anxiety. This is just a little taste of what you might hear from a counselor.